Welcome to the world of knowledge. So for today, we're going to talk about optic ataxia. Optic ataxia is a type of ataxia where the patient is not able to guide his or her hand towards an object with the help of visual information.
Optic ataxia was one of several symptoms of a condition that later became known as balance syndrome. When optic ataxia is severe, misreaching is obvious to the patient. Typically, the examiner will present an object, such as a pen, to the left or right side for grasping by each hand. That will be done both when the patient can look at the pen directly and when the patient must look straight ahead so that it falls outside of central vision. Two main patterns of misreaching are a field effect and a hand effect. A field effect whereby large errors are made with either hand on the side of space opposite of the damaged brain area, while a hand effect whereby the hand anatomically opposite to the brain damage misreaches for targets on either side. Balance syndrome. Patients fail to apprehend all but one of simultaneously presented objects at the same location. Condition is object-based, not location-based.
Comorbidity means more than one disease or condition is present in the same person at the same time. A patient with ocular comorbidities disease may have difficulties in their vision and mobility. Visual impairment has a relationship to this topic. The ocular comorbidities are related to visual disability. It also deals with some problems of the eye, cataract, glaucoma, and uveitis. As time goes by, the ocular comorbidities can be seen as the person ages. The reason why our eyes are affected because as people get aged, they're more likely to experience several symptoms to their body.
According to one study, rehabilitation training should concentrate on the improvement of visual scanning, the advancement of visually guided manual movements, and the improvement of the integration of visual elements. There have been a few recommended treatment methods, some of which have been criticized as being poorly designed and tested. Three approaches have been established for the rehabilitation of perceptual deficits, including those seen in balance syndrome.
Number 1. The adaptive approach includes functional activities that take advantage of the strengths and abilities of the individual, allowing them to compensate for problems or adjust the environment to lessen their disabilities.
Number 2. The remedial approach, which requires restoring the damaged CNS through engaging in perceptual abilities that can be generalized to all everyday living activities. Tabletop exercises or sensory-motor activities may ensure this.
Number 3. The multi-context approach based on the fact that learning is not passed automatically from one case to another. In a multiple setting with varying activities and movements demand, this requires the practice of targeted approach and integrates activities of self-awareness.
The hereditary ataxias are a group of genetic disorders characterized by slowly progressive incoordination of gait and often associated with poor coordination of hands, speech, and eye movements. Frequently, atrophy of the cerebellum occurs. The hereditary ataxias are categorized by mode of inheritance and gene in which pathogenic variants occur. The hereditary ataxias are a group of neurological disorders of varying degrees of rarity that are inherited, in contrast to a related group of neurological disorders that are acquired through accidents, injuries, or other external agents.